For those of you who don't know, AB 2098 will represent the total destruction of healthcare as we know it in the state and frankly in the country. So we're here with Dr. Kheriaty, who is going to be testifying for this state Senate hearing, excuse me. So Dr. Kheriaty, tell us what you're here for today.
Yeah, so I'm Kheriaty. I'm a licensed physician in California. I've been here for 15 years plus another 4 years for my residency training. So got my MD degree from Georgetown, went to residency at University of California, Irvine, and then worked at UCI as a professor in the School of Medicine for 15 years, where I also directed our medical ethics program. Chaired the medical ethics committee at UCI Health, chaired the medical ethics committee at the Department of State Hospitals for several years, and now I'm the chief of ethics for the Unity Project. I'm here because Assembly Bill 2098 will spell the end of good medicine in California should it move forward. And the reason this bill is so serious is that it basically amounts to a gag order on physicians. Assembly Bill 2098 is billed by its proponents as a way to tamp down on misinformation or disinformation related to COVID, which sounds on the face of it like a good thing, but basically what it does is it empowers the Medical Board of California, which is the board that licenses doctors to practice medicine in California, to basically discipline any physician who says anything publicly or even in the privacy of the doctor's consulting room that goes against the current quote-unquote consensus of the public health establishment in relation to COVID, whether it's in relation to the virus or different interventions for COVID, including things like vaccines. So the bill defines misinformation as anything that runs contrary to the general scientific consensus. There's several problems with that legal definition. I'm going to start, though, with basically what this is going to do to the doctor-patient relationship. Nobody wants to go see a physician who is bound by a gag order, who has a kind of guillotine hanging over his head, that if I say the wrong thing, my ability to practice medicine, my ability to support myself and my family might be taken away from me. And if you ask your doctor a question, you want your doctor to be able to give an honest answer. You want your doctor to say what he or she thinks. Now, you may not like the opinion that they give. You may decide, I want to go get a second opinion. I'm gonna follow your advice, or I'm not gonna follow your advice. But nobody wants to go see a physician where they ask the doctor a question and they get an answer that's not actually what the doctor believes, regardless of where you are on issues, let's say, related to the pandemic. I think we can all agree that a physician who says something only because of fear of what might happen if he speaks his mind is not a doctor that is trustworthy. The other problem with this bill is this notion of a scientific consensus being unchallengeable or unassailable or sort of fixed in a way that a physician or a scientist can't contradict it. And a good example of this is actually looking at the text of the bill itself. The text of AB 2098 cites 3 statistics about COVID. And it turns out that all 3 of these statistics from the time the bill was drafted until now have been shown to be incorrect. Our science and our scientific consensus has evolved. So the first statistic has to do with the total number of people who have died of COVID. We now know, and the CDC director has confirmed, that this number is inflated because for most of the pandemic, we were not distinguishing between people who died with COVID and people who had died from COVID. And if you make that distinction, you realize that that number has to be revised down very considerably. So the first statistic cited in this bill about misinformation is, in fact, itself misinformation, or it's old information, just to give the other side the benefit of the doubt. The second statistic has to do with the efficacy of COVID vaccines against hospitalization. And that's another number that has to be revised over time, because we know that efficacy with these vaccines is not fixed and static. It changes with time. The further out you get from your shot, the less effective the shot becomes. Also, efficacy has changed with new variants. So the statistic cited was the peak of vaccine efficacy against an old variant that's no longer in circulation. Against Omicron, that statistic no longer applies. The third statistic cited in the law basically is that the vaccines have been shown to be entirely safe. And with emerging evidence, we now know that that has to be revised or at least presented in a way that's much more nuanced. So just last week, for example, we saw a peer-reviewed study out of Israel showing that vaccines lowered sperm count in men. This was an entirely new finding. People have been paying attention to potential fertility issues in women, but until this study came out, no one had actually dug into potential fertility issues with men. So the whole issue of safety has to be nuanced, right? It has to be discussed in relation to a specific patient in specific circumstances at a specific period of time. And as new information comes forward, that old information needs to be revised. And this is, in fact, not unusual or abnormal. This is exactly how science and medicine works, right? But a law like this is going to impede and impair scientific progress because anyone who challenges a consensus in the name of advancing scientific ideas will be disciplined and punished, or after a few public examples are made of people who suffered those kinds of penalties, people will just stop asking questions. They'll stop digging deeper. They'll stop talking about what they're observing in the clinic in the case of physicians. Advances in science and medicine typically occur, and they start when a minority of doctors or scientists decides to challenge conventional thinking, decides to raise issues that could potentially revise what the current consensus judgment is. The other problem with this bill is that it politicizes medicine. The medical board is appointed by and directly responsive to the governor, and making the medical board sort of the long arm of enforcing the governor's preferred public health policies basically politicizes all of medicine. The medical board is going to oversee every physician who's practicing medicine in the entire state of California. I spoke last January at a Senate committee in the U.S. Senate in Washington, D.C., and I talked about this whole issue of consensus. And what I told the Senate back in January was that the scientific method suffered during the pandemic from a repressive academic and social climate of censorship and silencing of competing perspectives. And this projected a false appearance of a consensus, a scientific consensus, that wasn't real. It wasn't real because certain judgments were simply sidelined, were simply taken offline or refused a hearing. And so even this notion of consensus can be easily manipulated through censorship, and certainly through a law like this that not only threatens to take an article down that was posted online or even kick you off a social media platform, but threatens to take away the livelihood of a physician, which is the most severe penalty you can talk about when it comes to doctors in the state of California. If we look back on the last 2 years, it's very clear how frequently the so-called consensus was revised and changed over time. And we can mention countless examples. We can talk about the CDC's judgments on masks. People probably forget that early in the pandemic, the CDC recommended against masks. I remember hospital administrators at UCI yelling at nurses for wearing masks in the hospital that they had brought from home in the first weeks of the pandemic. The CDC flipped on that a month or two into the pandemic and started recommending masks. The CDC recently revised its judgment on masks, saying that N95s might have some usefulness in some settings, but the cloth and the surgical masks that everyone has been forced to wear around for 2 years really are not effective against COVID. So these kinds of judgments change over time. They change with political wins, to be perfectly frank. They change in the best sense of the term. They change in the direction of progress when scientific judgments and new scientific data is allowed to be heard. Frontline physicians play a key role in this process. So it was frontline physicians who made key discoveries about treating severe COVID during the pandemic. The idea that we should ventilate people in the prone position face down That was trial and error judgments made by frontline physicians in the ICUs. That was not ivory tower researchers doing some study somewhere for the CDC. Right? That is now standard of care. High-dose steroids for hospitalized patients, now standard of care, thanks to Pierre Corey and others who sounded the alarm that steroids were necessary to treat the inflammation in severe COVID. Many other examples like this could be given, but the point is that yesterday's minority opinion in medicine very often becomes today's standard of care. And today's standard of care in the future is going to be revised and improved by tomorrow's innovative minority opinion. What's going to happen if this law passes is that doctors who are forward thinking, doctors who are asking deep questions, the kind of doctors who actually advance medical science, they're just going to pick up and leave the state if they can't speak their minds, right? If they can't consult their patients according to their conscience and their own best medical judgment. Good science is always characterized by debate, right? You put a group of real scientists together in a room who know something about a topic, who've researched the topic, and what do? They will argue endlessly about, the salience of this study, about the methods used in that study, about the upshot of the research. As a whole, scientists engage in debate all the time. So this notion that many in the public have that science is always characterized by a kind of strong consensus in one or another direction just isn't how good science and good medical science actually works. It's very important to understand. The censorship of free inquiry and free speech in AB 2098 obviously spells the end of civil liberties for a certain group of people in California, namely physicians, who are subject to the disciplinary action of the medical board professionally. But it also spells the end of the scientific enterprise when it comes to COVID, when it comes to making advances. And we're going to end up in a state with people who are happy to be a cog in a machine. We're going to end up with a medical establishment that is not forward-thinking, that simply goes along with whatever the political establishment wants to push and wants to use science and medicine in order to advance. So this bill is not going to help us address the pandemic in California. Doctors are going to be punished for practicing good medicine according to their own best judgment. Informed consent will be compromised because if I can't give the patient accurate information, the patient's consent is really meaningless. This is the foundational principle of all good medical ethics. The trust necessary for the doctor-patient relationship is obviously going to be eroded and compromised by a bill like this. So I think it's important that all Californians encourage our lawmakers to oppose Assembly Bill 2098. It's going to harm physicians, it's going to harm medical institutions, it's going to harm scientific advance and progress in California. And most importantly, it's going to harm patients. That's the real problem with this bill. Not that some doctors are going to be unfairly disciplined. That's unjust and that's unfair and that's not good. But the real reason that's not good is that patients need good physicians. Patients need physicians they can trust. Without that, the entire medical establishment falls apart. And what that means is that patients are harmed. Thank you for your support. Thank you for listening. Get on the phone, get on the email, contact your state legislator, especially your state senators. Contact the governor. Let them know your opinions on Assembly Bill 2098. Help get the word out to others.
Excellent. Thank you so much. Perfect.